Hey, what's going on, everybody? Welcome back to the channel. And in today's video, I just want to go over a little bit of an introduction to the humerus and how understanding some different attachment points and how they can be beneficial to understanding how to remember where all the muscles are placed and how that can influence whether or not like what a muscle does or where it contracts and everything from. So let's just get right into it. So but on this picture, we can see kind of a more posterior aspect of the humerus bone itself. So just to get right into it, what we see is the greater tubercle. Now, if you follow my cursor, the greater tubercle is right up here. It's one of the more lateral tubercles associated with the humerus from what I currently know. And it can be seen a little bit, it can be seen anterior and posteriorly, but this serves as a common attachment point for the supraspinatus, infraspinatus, and teres minor muscles, a lot like those sits muscles off the scapula. So the supraspinatus sits kind of in that runway in the above the like in the supraspinatus fossa, right above the scapular spine, and the infraspinatus sits right below the scapular spine in the infraspinatus fossa. The teres minor actually sits a little bit above the teres major, and one of the biggest differences between the teres major and the minor is one, from what I know, is the size of the muscle itself. The teres minor sits a little bit above it, and it actually inserts into the greater tubercle. And muscles in general are contractile tissue. So whenever they are pulling insertion to origin. So a lot of these muscles help out with some external rotation. The supraspinatus, since it does originate more in that the supraspinatus fossa above the scapular spine, it has a little runway that attaches onto the greater tubercle. So what that does is actually helps out with a lot of the first initial degrees of abduction out of the humerus. Next up, we have the anatomical neck. A lot of what the anatomical neck does is to help divide the head of the humerus from the tubercles themselves. And then we also have the surgical neck, which is located between the head of the humerus and the body of the humerus, or the shaft of the humerus. From what I see, or from what I've read, is that the surgical neck is a common place for fractures due to its the muscles that surround it, where the strength of the bone itself. Now, I'm not entirely sure, but that's what I've read, is that the surgical neck is a common place for fractures. So next up, we have the deltoid tuberosity. So if we look at the anterior, the medial, and the posterior fibers of the deltoid, a lot of these fibers actually converge into one area on the humerus bone itself, which is where the deltoid tuberosity essentially gets its name. Then what is not shown on here is the radial groove. So if you follow my cursor, the radial groove typically is it starts more posterior medial, or posterior and medially, and it runs kind of in this diagonal pattern. And what that does is it helps gives rise to the passageway for the radial nerve, which is in the brachial plexus, in that C5 to T1-ish nerve root kind of passageway. And a lot of that is what helps out with like elbow extension out of the triceps and the anconeus muscle. Next up, going further with the posterior aspect, we have the medial and lateral epicondyles. So with the medial epicondyle, if you look at your arm, and if you were to supinate it and pretty much bring it level, you could feel a bony prominence right here. That is what we call the medial epicondyle. That gives rise to a lot of the attachment points for common wrist flexors, right? So if you were to flex your wrist forward, even sometimes if you were to ulnarly deviate it, right? So ulnarly deviating is like bring your wrist into adduction. So if we were to go this way, actually no, probably better to go this way. Adduction is going this way with the wrist. You'd feel the wrist flexors start to contract a little bit more. So going into wrist flexion and some ulnar deviation. With the lateral epicondyle, it's kind of the opposite. So a lot of these muscles actually help out with wrist extension and some radial deviation. So radial is almost like going into abduction. So with the medial epicondyle, we are doing ulnar or medial deviation. And then with the radial deviation, it's going like outside to the body. So radially deviating like that. So a lot of these muscles help out with wrist extension. And then like let's say the extensor carpi radialis helps out with some of that radial deviation. Next up we have the olecranon fossa. So now the olecranon fossa is kind of like this depression in the distal meaning further away, the distal posterior aspect of the humerus itself. So when you go to extend your forearm, we have the olecranon process of the elbow or of the ulna here. And when we go to extend, that olecranon fossa allows to accommodate for some of the olecranon process to go into that shallow landmark within the humerus, and allows for the elbow to complete extension. So now moving on to the more anterior aspect of the humerus, what we can see is the lesser tubercle. So the lesser tubercle, if you were to almost go onto your shoulder, I mean, it's a little hard to palpate, but the lesser tubercle gives rise to attachment points for some muscles. Some that I know are the subscapularis, the teres major, and the latissimus dorsi. So the subscapularis originates more in the anterior portion of the scapula itself, and it kind of goes anteriorly and attaches onto that lesser tubercle. So a lot of what it helps do is to internally or anteriorly rotate the humerus. Teres major, similar attachment point, but it's actually located on the posterior aspect of the scapula below the teres minor, and it kind of, and again, it goes anterior, almost like diagonal in a sense, but it goes anteriorly and attached onto that lesser tubercle, so it can help out with that as well. And then the latissimus dorsi. Latissimus dorsi typically originates at the thoracolumbar fascia, which is a little bit above like the more so the lumbar spine, kind of close to the posterior superior iliac spine. It originates right in the posterior aspect there, goes up about midway through the spine, hits a little bit of the inferior border of the scapula, and then attaches into the lesser tubercle. So a lot of what that does is some internal rotation, extension, and adduction of the humerus. Then we have the intertubercular groove or sulcus. This is also known as what I know is also called the bicipital groove. And this provides a runway for the tendon of the long head of the biceps. So the short head of the biceps typically originates on the coracoid process of the scapula, and the long head, the tendon, typically runs through the intertubercular groove or sulcus of the humerus itself. And it helps to separate the greater and the lesser tubercles of the humerus from that anterior view. Now the pectoralis major, when we talk about like the lap between two majors, the pectoralis major typically attaches to the lateral aspect of this groove. So we can see the lesser tubercle here, the greater tubercle here, the intertubercular groove or bicipital groove slash sulcus. That tendon runs through here. From what I know, or from what I've learned so far, is the pec major, it typically attaches on the lateral aspect of this groove. So a lot of what the pec major does is like some flexion, some internal rotation, some adduction, helps out with those kind of movements. That's typically where, from what I've learned, the pec major inserts into. Then we also have the lateral supracondylar ridge, which would be right over here, and it serves as attachment points for the brachioradialis, which is primarily an elbow flexor. It is a biarticular muscle, but it does help with a lot of elbow flexion. And then the extensor carpi radialis longus, which helps out with wrist extension and hand abduction. So to continue on here, we also have the radial fossa. So the radial fossa helps to accommodate some of that movement from the radial head when it's going into flexion of the humerus. So the radial head is kind of like this convex surface or concave surface. And the capitulum, which is what we're getting into now, the capitulum is a convex projection, right? So if we look at my cursor here, we have the capitulum, which looks like this rounded surface. We have the trochlea right over here. So now the capitulum, you can see the head of the radius is more this concave surface. The capitulum is a little bit more convex. When the elbow goes to flex, the radial head actually falls along the groove of the capitulum and goes a little bit into that radial fossa to accommodate for the flexion of the elbow. With the trochlea, right? So we can see we have this kind of rounded surface here, but then what ends up happening is the trochlea provides the articulation for the coronoid process of the ulna. So if you want to look at it, your ulna is almost shaped like this. So your coronoid process is like right here. What ends up happening is that when you are to flex your elbow, your trochlea actually helps out with the articulation for your coronoid process and allows for that smooth gliding of the ulna during elbow flexion and extension. So it helps out with that. And yeah, so if you guys have any questions, leave them in the comment section below. I'm trying to learn this stuff as best as I can, but I hope you guys enjoyed this video as much as I did making it. And yeah, thank you guys for watching, and here's to getting strong. Thank you.